Welcome to the lifestyle segment of the weekend show, where we will be having a conversation on the recent cholera outbreak in the country, particularly the cause, the risk of getting it, how it spreads, how it can be treated, but most of all, how it can be prevented. Joining us, we have Dr. Titilayo Kayode Alabi, who is a pediatrician. Good morning.
Good morning.
And thank you so much for joining us.
Thank you.
And we also have Dr. Umeke Emmanuel Ugochukwu, who is a medical officer. Good morning, and thank you so much for joining us today.
Thank you so much.
All right, I would like to know your initial thoughts when you heard of the cholera outbreak, because personally, I felt it was, something that happened back in the day and not a modern day sickness. So, with lack of a better word. So, what were your thoughts?
Okay, it's interesting that the cholera outbreak occurs yearly. And even though right now the focus is on Lagos State, Bayelsa, because they have the highest number of cases and deaths, and then other states, like you mentioned in the intro. However, cholera outbreaks occurs almost every year. We have them in bouts, off and on. Sometimes one or two suspected cases, no confirmed cases, no deaths. It is a problem that has been, because like you said, we are going to discuss the causes, because most of the causes have not yet been addressed. And then, of course, sensitization, even though it is ongoing almost every time, people still are ignorant, of the right things to do to prevent cholera being infected with the disease.
Okay, Dr. Gochukwu, why is it that this year it's become an outbreak?
There have been previous outbreaks. As back as 2 years ago, when I was a house officer in Niger State, we had an outbreak. It affects both kids. These places where the people do not come out. It's like they are not closer to the mainstream system where they will come and talk about this more often. There's been heavy outbreaks at those regions, because I remember the last time we had almost up to like 10 to 20 cases I saw in IBB Specialist Hospital at the point where I was working there. And with the good system we had over there, there was no death case at the moment at the hospital I worked at. But then there's always been an outbreak every year.
Okay, so you're saying that this time around it's out there because it's now in the urban cities and not just the rural areas as before.
Yes.
Okay, so Dr. Titley, I would like you to, talk about the causes. What causes it?
Okay, so cholera is a fecal-oral disease that is caused particularly by a specific type of bacteria, the Vibrio cholerae. Of course, it has different variants, but two major variants of the Vibrio cholerae are responsible for cholera infection in humans. So that is the classical and then the L-tor variant. But there are other variants that may infect other non-humans, like even plants. Talking about the etiology, I already said that beyond it being caused by a specific organism, there are different things that predisposes someone to being at risk of that. And I guess we would all still get to that.
Oh, no, please.
So I should go ahead.
Yes, please.
So it is fecal-oral, right? Now, the most important thing that we must know is that fecal-oral infections mean that infection that we get from what we put into our mouth. That can be from water, contaminated water. Remember, we had mentioned an organism. So a water source that is contaminated with that organism, or a particular type of food that we take that is contaminated with the organism. And where are the places we can get this? On the street. For example, in Lagos State, one of the suspected sources was from a tiger nut milk that most of the people in Etiosa drank. That even though it has not been confirmed, by the Lagos State government, but one of the things that a lot of people had in common as a denominator was that tiger nut milk. Having, taken the tiger nut milk, it could be from contaminated food. leaving our food, even when it is properly cooked, exposed without necessarily covering it. Then we have flies, that have been probably in a that have had contact with feces or some sewages or waste outside. When these flies perch on these things and then they come perch on our food, then they infect the food, we take it in, and then that is it. And then taking raw fruits, raw vegetables, without having properly washed them. Let's say, for example, I'm walking and I'm walking under the sun, I'm thirsty or I'm hungry, and I just wanted to buy maybe pineapple. Those cut pineapple in nylons. This pineapple could have been infected. I was not the one that cleaned. Or coconuts that are even mostly exposed. Sometimes they would even cover with some cling film, the pineapples and maybe pawpaw. But coconuts are exposed. If I buy these fruits, apples, without washing them properly, and I just bite on them right there while walking on the road. Now, the fruit might not even necessarily be the problem, then my hands. My hands may be infected because I could have come in contact with anyone along the way that has, the cholera, the Vibrio cholerae, maybe in their hands or in their fingers or something. So it is mostly a disease that is caused by poor hygiene, our personal hygiene, poor sanitary, hygiene. Talking about how we dispose our sewages and our waste. It is caused by transmission through contaminated food. And even some other people are at risk, like those living in overcrowded places that do not have good sanitation, good waste disposal. And then you find in some of these places, even their toilet pipes are leaking. And people are just, moving around. Then the closeness of their toilets to their water sources. You could just have a well that they drink water from that may not be boiled. And this well is very close to the latrine. And it is advised that a pit latrine or any other sewage source should be at least 30 meters away from a water source. So I believe that these are the things that people should know as risks, for getting the infection.
Dr. Ugochukwu,
Yes,
earlier you mentioned children.
Yeah.
So who else is at risk for getting cholera? Is it just children and maybe old people? Is it the young people? Is it everyone?
Everybody. There's no specific person, whether newborn, whether an adult, whether an elderly patient. Everybody is prone to get the illness. Just like she said initially, it's a fecal-oral route of transmission, which means you take up this bacteria from water source, from maybe an infected person that just passed stool, from food. Most of these foods, with the irrigation systems, when you have a water body and someone just put somewhere around the region and maybe it's flushed into the water body, and then you use the water to cultivate foods, vegetables, and every other thing, and then it's taken out to the public, and then maybe improperly washed, and then the person just picks it up, eats it, and just immediately after eating, then you start having these signs and symptoms of cholera.
How has this recent outbreak, compared to previous ones that you've experienced, like you said earlier?
With the recent ones, it's just been around some certain states, and it has not gone widespread at the moment compared to other previous years.
32 states.
It's still within Nigeria at the moment, because in other cases that we have them coming all the way from Asia, from South America into Africa, it has not gone outside the surroundings at the moment. So it's not as bad as because other years the death rates are usually very high compared to now that medical systems are trying to pull down most of the effect of the whole thing around.
So how can we prevent it now, Dr. Titilayo?
So for prevention, it is straightforward. We know what predisposes us to Vibrio cholerae infection. So the first thing is paying particular attention to hygiene. Everybody. And even if FCT and probably some states, are not as affected as the others, because amongst the 32 states, we know that there are some particular states that are more hit than the others. Everybody should pay attention. One of the things we should note is that a risk of traveling. So you could have a family member who travels to Lagos and comes back with the infection. So everybody, we should not wait until we start hearing about cholera infection in our setting before paying attention to our hygiene. And what do I mean? Washing of our hands. We must wash our hands before and after eating. We should take proper attention to our food. Cook our foods properly. And if we are going to take fruits and vegetables, they must be properly washed before we ingest them. And also, apart from that, when we cook our food, even after it's been well cooked, we must remember to cover them. They shouldn't be left exposed where flies can easily perch on them. The other thing is that for those who, I would say, save water, but I also know that not everybody has access to safe water. Some people would even call sachet water safe, but you cannot even tell where these people that produce them or sell them are getting their water. Some of them are not treated. So as much as possible, if we can tell that our water source is not safe, then we should boil our water before drinking them. Then prevention, even though we'll talk about what we can do. The other thing is that we should also remember the vaccines. So this will go to both the government and then the individuals. The vaccines are available. That's the oral cholera vaccine. It's available, but it is not free. So it is not part of the national program on immunization vaccines. So people may not readily take it. However, because we continue to have outbreaks of cholera yearly, I believe that government should begin to look into providing this vaccine and giving people ahead of time, not when the outbreak starts and then we start running around looking for it and all. And we are not the only nation asking for it from the donors. So we find that by the time we are asking for it, the demand, the demand is really high compared to the supply. So the vaccines, people should get it. And then also for government, I believe that in those places where the standard of living is really poor, where there's overcrowding in refugee camps, in even places where it is not readily refugee camps, the government should please help with their sewage disposal, help with their disposal of refugees, and then provide them with good safe water. Boreholes, installing boreholes in some of these places can help the people, with preventing cholera.
So we're talking about prevention, causes, and all of that. But what are the symptoms? How would I know someone has or I have cholera?
So one of the initial, because it's an acute diarrhea disease, so by the word acute, it means the action, by the time you take in the organism inside, it takes 12 to 5 days before you start seeing the effect of, usually 12 hours up to 5 days, because 12 hours is a very short duration. And then the symptoms are usually diarrhea, that's purging, like passing of loose stool, and then vomiting. So particularly, you have other forms of diarrhea, but in this particular aspect of diarrhea, it's what we call a rice water stool. The water is so, it looks like from a parboiled rice that is about to be rinsed. It's so pale and whitish in color, and then the persistent, it usually continues. Each time, every minute or hours the person goes, the person keeps on throwing up and vomiting, throwing up and vomiting, and then the particular period of time, from other aspect of diarrhea, in this particular type of illness, there's no fever. So it's usually just throwing up and passing loose too, throwing up and passing loose too. And then the effect gets you, it weighs you so down that you've lost a lot of water, you've lost a lot of electrolytes, and the person becomes weak, person becomes dehydrated, and it's a very fatal, it's a very dangerous illness, because between space of minutes or hours, there's chances that you're going to lose this patient if there's no medical care that's given to this patient.
Wow, I'm so surprised. 12 hours. That's a short period of time. So how responsive has the government been in all of this? Has there been public awareness from healthcare centers by the government and NGOs, all of that?
I know that government has been putting in a lot of efforts, in curbing, in sensitizing people. Recently, I checked on Professor Aki, I think on the Commissioner of Health for Lagos State. I checked his profile, and I even saw that he went ahead as on Instagram, as he went ahead as sensitizing people in Yoruba language. So governments are in one way or the other trying, sensitizing people, talking about it. And then you also find them tracing water sources, tracing food sources, going to restaurants, canteens, around the places where some of these cases have been reported, going there and then, just, trying to find out where the source may be. And then we've also found states, providing cholera treatments for free. I believe that is a lot of effort. And of course, there's been a lot of effort with the National Primary Healthcare Development Agency requesting, with much zeal for the cholera vaccine, from our donors. So, and yes, organizations like WHO, UNICEF have also come in, we are meeting with the Federal Ministry of Health, meeting with the NCDC, the National Primary Healthcare Development Agency, Federal Ministry of Environment and Water Resources. You find meetings ongoing, and some emergency operation centers are actually being created. Numbers are on displayed in different places on media. And yes, media, is also, there is a whole lot of partnership with media where people are making a lot of noise about this. And I believe that government is trying their best, and then individuals on their own too are, educating people about the cholera outbreak.
Okay, earlier you said that this happens every other year. So what are the long-term strategies to prevent cholera outbreak?
Talking about long-term strategy, the vaccine is important.
Okay.
We should not wait until the outbreak starts before we start stocking. We shouldn't, the country should, the government should take note of that. I'm sure they are aware. The vaccine is important. It might be necessary for us to vaccinate people, especially those who are at high risk. Children less than 5 years are particularly at high risk of being infected and then also dying from the severe illness. The government should please act on that. If possible, make it go around and do some form of emergency vaccinations for people. Do it over a period of time. It doesn't prefer long life immunity, but at least in the next 2 to 3 years, as high as 5 for some of the vaccine type, it can provide some immunity. Ongoing sensitization, we should continue to educate people, talking about what causes it and how to prevent it. And like I said earlier, it is important to pay attention to places that are particularly prone, places where their water sources may just be a river or a stream around them, places that don't have safe water. There are still some places that don't have a water source. You might find a borehole that was erected several years ago that is not functioning. Places that are overcrowded, we still have that. Even in the best, the supposed very rich states, you still have places that are markedly overcrowded, where their water source is as close to the pit latrine as I am to you. Those are things that government should work on, and that will involve talking about poverty eradication, because you can't talk about improving people's lifestyle and their livelihood without really talking about poverty eradication. Long time, it's mostly on the government, but everybody should take care of themselves. Yes.
All right, so before we go, Dr. Guchuku, is there any advice you'd like to give Nigerians in regard to this?
Just like the pediatrician has said, she had almost said everything that is necessary to be said. She picked on almost all part of it, from sensitization of the people about this whole thing about cholera, the bacteria itself, the route of transmission, the signs and symptoms, the preventive management. Other things I would like to add about is still put more, the government should, like she said, the government should try as much as possible to work on getting the cholera vaccine for the people. I think if the vaccine is free, maybe affordable to the people, then the outbreaks, how do I put it? The recurrent outbreaks, yes, would be maybe hold to some extent. I also think they should work on decongesting areas where they are overpopulated, overcrowded, and then work on the sewage system and drainage system, and then as well as work on providing good water sources for the people. And I
All
think
right.
it would be better.
Yeah.
Thank you.
Thank you so much, Dr. Tikle and Dr. Ogochukwu,
Thank you so much.
for educating and informing all of us, myself included, yes, on the cholera outbreak. Okay, and that's it for the lifestyle segment. I hope we've all learned a thing or two. Good hygiene and provision of vaccines from the government, very important. All right, we'll go on a short break now. When we come back, we'll bring you more on the weekend show. Just stay with us.